Who do we have here?
This is Angie. She sprained her foot today at spring day, trying to be like Billy Flores. But she'll be okay.
What'd you give her?
Cubicin.
You gave her what? You can't give her that.
Why not? She isn't the elderly, and we all know that Cubicin is contraindicated in the elderly.
Or the pregnant.
Oops.
Do you know what you've done?
Okay, we got this. But really, what's the worst that could happen?
Well, she could get dizzy. Or shortness of breath. What is going on in here? Coco, the wonder nurse, gave her patient Cubicin. Her pregnant patient.
Hey,
All right, what's the worst that could happen here?
she could get a rash.
Hush.
What is all this commotion? I can't even hear Grey's Anatomy going on in the next room.
Well, Captain Cubicin gave her patient the wrong medicine.
Yeah, and she's trying to find out all the ways she can kill her patient.
Okay, now everyone calm down. How would Meredith Grey handle this? What's the worst that could happen?
She could vomit all over.
What's going on in here?
She gave her patient Cubicin.
Okay, fine. I gave my patient the wrong medicine. What's the worst that could happen?
She could go into anaphylactic shock and die?
Oh, yeah. That's pretty bad.
Oh, wait. I didn't give her Cubicin. I gave her Demerol for the pain.
What?
What?
What? What you have seen here today is comedy, and hopefully you found it funny. However, medication errors are no laughing matter. Precaution and prevention need to be taken very seriously. Daptomycin, also known as Cubicin, is an anti-infective used in bactericidal therapy for Staph aureus bacteremia, including right-sided endocarditis caused by MRSA, and is also used for complicated skin infections. It is contraindicated in the elderly and the pregnant and lactating. Safety has not been established in pediatrics. Adverse reactions and side effects include dizziness, dyspnea, hyper and hypotension, constipation, diarrhea, nausea, vomiting, pruritus, fever, rash, anemia, and reactions at the injection site. Assess patients for bowel function as well as symptoms of infection. Signs and symptoms of pseudomembranous colitis may not present until several weeks following cessation of therapy. Patients should be advised to avoid driving or other activities requiring alertness until response to medication is known, as this medication is known to cause dizziness. If fever or diarrhea develops, especially if the stool contains blood, pus, or mucus, notify your physician. Never attempt treatment without physician's help.
Really?
What? Oh.